Hi, I'm Katharine Kripke. I have a PhD in immunology from Stanford University, and I've been spending the past 10 years doing mathematical modeling of HIV prevention. So in this video, I'm going to be sharing some informed speculation about the origin of SARS-CoV-2 and some possible future outlooks for the pandemic. So the image shown here comes from a website called nextstream.org. What you're looking at is an evolutionary tree of all of the variants of SARS-CoV-2 that have been sequenced and submitted to the database. And the evolutionary tree shows branches where we have earlier variants that are closer to this bar in the middle here. This is an unrooted tree. And the farther away they are means the more mutations they've had related to the ones that are closer into the bar. So, and they're colored based on the different lineages and variants that have been described. So what you're looking at here in the dark orange, those represent the Omicron variant. So different mutations that are all part of a cluster that are categorized as Omicron. And when I looked at this, one thing that I noticed is that the Omicron are all very far away from all of the other variants that have been sequenced. And there's nothing in between. If you look at these other branches, we can see, how these variants have progressed over time and developed into variants that, accumulated mutations, more and more mutations that take them farther and farther away from the ancestral strains. But there are no intermediate variants for Omicron, almost none. So the closest related variant to Omicron was described, if you go on the website and you hover over one of these, you'll see that the closest variant was described in September of 2020. So a lot of scientists are seeing that Omicron likely developed in some person who had a long-term infection with SARS-CoV-2 and was unable to clear the virus, probably because they were immunosuppressed. And they just accumulated a lot of mutations until finally Omicron popped out. But that doesn't make any sense to me, because I think that if it had been in a person, that some of these intermediate variants would have gotten out into the human population, especially because they had mutations that help to evade immunity. So the fact that you have all of these variants that are so far away from anything else that has been sequenced and described suggests to me that this the lineage that produced Omicron wasn't developing in humans at all. And there's a lot of evidence actually that SARS-CoV-2 can infect animal populations. So as one example, there's a publication by Chandler et al. That found evidence that SARS-CoV-2 was found in 40% of white-tailed deer in the United States. So we call this a reverse zoonosis. So a zoonosis is when a virus crosses from an animal to humans, and a reverse zoonosis is when it crosses from humans back into animals, and then it can cross back into humans again. So what I'm supposing, looking at this evolutionary tree, is that it seems very unlikely that Omicron evolved in the human population, because if that were the case, we would see intermediate, we wouldn't just see something popping out with all of a sudden 50 mutations compared with the other strains. We would see some intermediate variants with fewer mutations that would be along this branch. So to me, this looks like something that went back into animals and then back into humans, a reverse zoonosis. And that has some implications potentially for the future of the pandemic. So now I'm going to talk you through my view of what we're looking at, and this is January 2022. So let's first look at these graphs on the left. So I got these off of Google just by searching on new COVID cases. And they have this really nice interface where you can select a country, you can select regions of the country, you can even in the US go all the way down to the county level. It's really nice. So what we're seeing here is a graph of the number of reported cases per day since the beginning of the data reporting. And here's South Africa. So this spike here is the Omicron wave in South Africa. And you can see that it went up and then it went down quickly. So it was because Omicron is so highly transmissible, it spread through the population quickly, and then it was cleared fairly quickly. So, and here's the United States. So you can see that we're still in the rising part of the number of cases that are being caused by Omicron, and it's completely dwarfed the prior waves that we've had. And so we're hopeful that just like in South Africa, this will come back down once it reaches its peak, wherever that's going to be. It'll come back down about as quickly as it went up. So given that projection, we're hoping that there will be a short wave of Omicron in the United States that will end maybe by the end of February or maybe latest around March, as it passes through the population quickly. So I think that there are some different possible futures that could come out depending on biology and depending on public health response. So let's look at the best case scenario first. Some people have speculated that Omicron may be the last variant. Now, it's true that viruses there are limits on how much they can mutate, because a mutation may help the virus to evade immunity, but the mutations may also destroy the functionality of that protein. So there's a bit of a balance, and the mutations are kind of balancing between evading the immune response and not messing up the functionality of the virus. So it's possible that with Omicron, the virus has actually exhausted its ability to generate new mutations to evade immunity. That would be a very nice outcome. So what comes next really depends on a couple of things. So one is if it's true that Omicron is actually represents a reverse zoonosis, as we just discussed, then as long as there are people who are not immune, or if they've been infected through natural infection and they haven't been vaccinated, their immunity has been shown to wane, just in a matter of a few months. So, and people can get reinfected. So if it's a reverse zoonosis, there may be more reverse zoonosis in the future. So Omicron may spread throughout the world, and it may that may produce some temporary immunity against the virus, and we may see a lull for a while. But as long as the virus is spreading in animal populations and may cross back into humans, we can see future waves of the virus. And this is mostly going to affect places that don't have high vaccine coverage. Why? Because the immunity that is generated by the vaccines is actually stronger and more durable than immunity from natural infection. So, and we've seen that in many places in the world where there have been waves of COVID, and they thought that people had been, that there was herd immunity in an area, but such as in Manaus, but Brazil, another wave comes along and people can be infected again. So in places without high vaccine coverage, if there's continued vaccine apartheid, meaning not good coverage of different places in the world, we could see the virus be reintroduced into the human population over and over again. Now, that could go on indefinitely. On the other hand, if there are not reverse zoonotic transmissions, if I'm wrong about this, then Omicron could actually be the last wave. We could be done after that. And then another good outcome would be if vaccines are scaled up globally and people are protected. So even if there are more reverse zoonotic transmissions, people are protected using the vaccines, and we're not going to see any really bad outcomes from subsequent introductions of the virus back into the human population. So that's one possible branch and some possible outcomes. And then another possible branch would be that we might see a 6-month or maybe longer break from new variants. But if the virus hasn't exhausted its ability to evade immunity, we might see new variants emerging and additional waves coming from these immunity evading variants. And we don't know how severe in terms of the disease these additional waves are going to be. And so, this could go on for years potentially. So what's the end game here? Well, the end game in this scenario is that over time, probably over some matter of years, the virus, we hope, would evolve towards mild disease and might cease to be a public health threat. But this could take a while. We don't know how long. And then another potential good outcome in this case would be that scientists develop a vaccine that can protect against all the possible variants of COVID-like viruses. So we might call this a pan-beta sarbecovirus. That's the whole family of viruses that SARS-CoV-2 is a member of. And scientists are working on developing vaccines that could protect against this whole family of viruses. So once those vaccines are developed and deployed worldwide, we could see the end of the pandemic and even stopping future pandemics from related viruses. So that would be really the best outcome. But again, we don't know how long it's going to take to develop these vaccines. We can hope that it's soon. It might be in the next year. It might be in several years. We're not sure. That's kind of how science works. So that's my forecast and outlook for what might be next in the pandemic, depending on a number of biological and public health factors. And I will thank you. And this is the end of my presentation. Thank you.